We reached the final moments of our event today, so I'm very delighted to introduce Dean George Daley, who will provide some final reflections for us as we close the symposium. Dr. George Daley is the Dean and Caroline Shields Walker Professor of Medicine at the Harvard Medical School. Dean Daley is a world-renowned physician-scientist whose leadership has shaped the landscape of cancer biology and stem cell science. Dean Daley's career has spanned the most prestigious institutions in our community, with leadership roles across Harvard and MIT, Boston Children's Hospital, the Massachusetts General System, and the Brigham Women's Hospital. But more than that, he has been a tireless advocate for the very cross-disciplinary conversations and collaborations that we have seen in the stage today. Dean Daley, we're very happy to have you here, so please, the podium is yours. Thank you.
Thank you. So I just spent the last hour with Dr. Hanan Balki, who is the RD for the Eastern Mediterranean region of the WHO. And we spoke a lot about the common interests and common mission that we have. The Harvard Medical School is the anchor of a 17-institution consortium, the Massachusetts CPR, which is our pandemic preparedness enterprise. And obviously there's tremendous interest in ongoing pandemic surveillance at WHO. What better organization to do that? We also talked a lot about biosecurity, which has become a new interest of mine through programs at the Harvard Kennedy School, where several of the members of the Biden administration, the national security apparatus, are now working and carrying the ongoing importance of that mission at a time when much of the internal structures for biosecurity and pandemic surveillance and the overlaps of those two have been dismantled. So I am here, and I respectfully apologize for parachuting in at this last minute. I would have much preferred to have actually spent the entire day being here and being educated and enriched by all of the commentary today. But I'm here really as an expression of the solidarity and the deep respect that I have for all that you do. So I appreciate being given the opportunity to make some closing comments. So who did I miss? I missed Dick Chalma. I missed Dick. I missed Dina Bebe. I missed a whole bunch of you, and I'm sorry for that. But I am proud of the fact that under Louise's tremendous leadership of the Harvard Global Health Institute, that we can continue to convene the most brilliant minds from around the globe around such important topics. And I'm sure that the chorus of voices that sung today were rich and inspiring. I want to add another voice to the mix, someone who was part of the Harvard community, someone who received a master's in public health from our Harvard T.H. Chan School of Public Health, and that's Bill Foege. And that's a name that maybe already surfaced today, but certainly many of you know as a legend of public health and a former CDC director. And Bill passed away in January at age 89. Now, Bill was a standard bearer for global health innovation. His innovation brought about one of history's most extraordinary examples of collective action. And the story here, I think, is an important one as we face the rise of vaccine hesitancy in the United States. So it was in the 1960s when Bill and his colleagues working in rural Nigeria were struggling to control smallpox outbreaks. And they had limited supplies of vaccines, and so they got creative. But they got creative in an evidence-based way, and you will know this better than I, but instead of aiming for mass vaccination, they decided to focus their efforts on rapidly identifying smallpox cases and then surrounding them with rings of immunity, the whole strategy of ring vaccination. And of course, that has become the mainstay of the World Health Organization's smallpox eradication campaign. And as Bill wrote, the world's last known smallpox case was apparently that of a cook in Somalia in 1978. It was 2 years later that the WHO declared smallpox officially eliminated. And today, we live in an unspoken and underappreciated reality that smallpox is a thing of the past. Those of us who maintain the interest in biosecurity hope that that statement is indeed true. Now, for Bill and his team, it was a limitation that forced innovation, and innovation opened that door to possibility. And from there, possibility morphed into a plan to actually finish the job, and that was then fueled by collective action, global collective action. Now, Bill was once quoted as saying that smallpox eradication was not an accident. It was the result of a plan conceived and implemented on purpose by people. Now, indeed, that limitation which spurred innovation, which led to possibility, which ignited a worldwide plan, it might seem that that's sort of a vast expanse, but those steps happened. They happened in quick succession, and it took an idea, it took energy, and it took a plan. Now, global health has faced an onslaught of difficulties in the past year. I empathize tremendously with so much of what has been lost. And I heard of that so much from Dr. Balke. Lives lost, opportunities lost, cuts in U.S. international aid funds, new award structures from the National Institutes of Health. As you all know, these have massively altered the calculus of how world public health gets done, gets supported, gets implemented. So it's limitations again. Limitations that are going to drive and have to drive innovation. It seems that the limitations are infinite. They're coming at us from all sides. But it's solidarity that is of quantifiable benefit. We know that when we come together, we can measure the benefit. So I just want to repeat that I am deeply proud to be engaged with the Harvard Global Health Institute. I am a member of the executive committee. I'm deeply grateful to all of you for coming today to nurture a sense of solidarity. Solidarity is what it is what we all need to have to be able to innovate and to catalyze collective action for the benefit of humanity worldwide. And that is the charge of the Global Health Institute, and it's what the world desperately needs. Now, there's another revolution underway, and that is the revolution of AI. And I think we're focused a lot on AI-enabled drug discovery. And I actually hope, and there is a lot of collective hope, that AI is going to be a force that is going to democratize drug discovery and provide innovation that could really transform global health. In our community, there has been a cure, and I use the term boldly, there's been a cure developed for sickle cell anemia. But it involves an extraordinarily heroic and expensive ex vivo gene modification. But innovation in the form of in vivo delivery of the gene editing cargo, equivalent to a one and done single shot vaccination, that's the innovation that we need to democratize that kind of intervention across sub-Saharan Africa where it's needed most. I can tell you that folks here at Harvard and many outstanding scientists around the globe are working towards that innovation. I think one of the things that we're going to have to realize, because we are also here in the United States reeling under a new relationship between academia and our government. We hope that distancing of the relationship is a transient one, but who knows. What's that is meaning, though, is that it's driving us to look towards new partners, and we look increasingly to partner with industry. In the past, academia, we've always had a sort of haughty approach where we'd go to our pharmaceutical partners and we'd tell them all about our latest, greatest science, and we'd say, oh, what do you want to fund? Well, we take a different tack now. We're actually partnering with industry in a way where we ask them what are their challenges. Because we have such an extraordinary, broad, and diverse community that no matter what challenges they have, we can coordinate and convene a pool of scientists who can address those challenges. And so what we're doing now is forging new partnerships that involve co-conceiving and co-executing on some of these great challenges, and we do think that this is going to lead to new treatments. So I hope that that also has some resonance for the kinds of challenges that we're facing in global health. So everyone has got to be also thinking about the way that highly innovative new medicines, especially the GLP-1 agonists, are on the one hand offering tremendous benefit in metabolic and cardiovascular disease, but on the other hand, upending the insurance markets across much of US and Europe. But in fact, the semaglutide patent recently expired. Thankfully, patents expire. And Indian drug makers are jumping in to create generics. And so I know it takes time, but revolutions happen, and ultimately we expect those revolutionary treatments to be globally distributed. I would say we shouldn't always have to wait, though, for the patents to expire. The field of global health has to be bringing more of energy around equitable access to therapies through any number of channels, and it's one of the reasons why we are involved in policy advocacy as well. So I've just spoken about a few of the innovations, but I want my core theme to be that we are one small planet. You know, the astronauts that flew on Artemis II talked about looking back on that small spaceship Earth. We are here all together. It is one globe. We are one global health community. And so I want to just congratulate all of you and thank you for coming together in defense of the better health for all. So thank you very much. I'll turn it back over to Louise.
Thank you so much, Dean Daley. There's nothing that I would like to add to that in closing. I just want to share a number of thanks. I would like to thank the Harvard Global Health Institute team who put together really masterfully this lovely day for us and helped all of our visitors with their travel. I would like to thank all of you who were speakers or moderators, all of our audience members. I'm really grateful to our partners across Harvard, Harvard Law School, Harvard Medical School, Harvard School of Public Health, and the David Rockefeller Center for Latin American Studies for partnering with us today. That means a lot to us. And I'm very grateful to Harvard University and to the Office of the President and Provost for supporting Harvard Global Health Institute and allowing us to convene such a lovely day today. So with that, I will close up the session. For those of you who are online, thank you so much for bearing with us, and we'll say goodbye. And for those who are with us here in person, we invite you to a short reception where we can continue some of the conversations. Thank you so much, everybody. Have a good evening.